Question 1. Which of the following are the two main body cavities? Thoracic and abdominopelvic cavities, dorsal and ventral cavities, cranial and spinal cavities, or pleural and pericardial cavities? The correct answer is option B. The two main body cavities are the dorsal cavity, posterior, and the ventral cavity, anterior. Question 2. The dorsal body cavity is subdivided into which two cavities? Thoracic and abdominopelvic cavities, pleural and pericardial cavities, cranial and spinal cavities, or abdominal and pelvic cavities? The correct answer is option C. The dorsal cavity contains the cranial cavity for the brain and the spinal cavity for the spinal cord. Question 3. Which cavity contains the heart, lungs, esophagus, and trachea? Abdominal cavity, pelvic cavity, thoracic cavity, or spinal cavity? The correct answer is option C. The thoracic cavity houses the heart and lungs, as well as the esophagus and trachea. Question 4. The ventral body cavity is subdivided into which two main divisions? Cranial and spinal cavities, thoracic and abdominopelvic cavities, pleural and pericardial cavities, or abdominal and pelvic cavities? The correct answer is option B. The ventral cavity is divided by the diaphragm into the superior thoracic cavity and the inferior abdominopelvic cavity. Question 5. Which serous membrane directly covers the surface of the lungs? Parietal pleura, visceral pleura, parietal pericardium, or visceral peritoneum? The correct answer is option B. The visceral pleura adheres to the surface of the lungs, while the parietal pleura lines the thoracic wall. Question 6. The potential space between the parietal and visceral layers of a serous membrane is called the serous cavity, mediastinum, mesentery, or retroperitoneal space. The correct answer is option A. The serous cavity is the potential space between the parietal and visceral layers, containing serous fluid to reduce friction. Question 7. Which structure divides the thoracic cavity into right and left pleural compartments? Diaphragm, pericardium, mesentery, or mediastinum? The correct answer is option D. The mediastinum is the central compartment of the thoracic cavity, separating the two pleural cavities and containing the heart, trachea, and esophagus. Question 8. The pericardial cavity surrounds which organ? Heart, lungs, liver, or stomach? The correct answer is option A. The pericardial cavity is the potential space between the parietal and visceral layers of the pericardium surrounding the heart. Question 9. Which serous membrane lines the abdominal wall and covers the abdominal organs? Pleura, pericardium, peritoneum, or mesentery? The correct answer is option C. The peritoneum is the serous membrane of the abdominal cavity, with parietal layer lining the wall and visceral layer covering organs. Question 10. A double layer of peritoneum that suspends the intestines from the posterior abdominal wall is called A, serous membrane, mesentery, ligament, or omentum? The correct answer is option B. A mesentery is a double fold of peritoneum that attaches organs to the body wall and carries blood vessels and nerves. Question 11. Which of the following organs is retroperitoneal? Stomach, liver, small intestine, or kidney? The correct answer is option D. Retroperitoneal organs, such as the kidneys, pancreas, and duodenum, lie behind the parietal peritoneum. Question 12. The greater omentum is a specialized mesentery that attaches to which structures? Stomach and transverse colon, liver and gallbladder, small intestine and large intestine, or spleen and pancreas? The correct answer is option A. The greater omentum hangs from the greater curvature of the stomach and attaches to the transverse colon. Question 13. Which cavity contains the urinary bladder, reproductive organs, and rectum? Abdominal cavity, thoracic cavity, pelvic cavity, or cranial cavity? The correct answer is option C. The pelvic cavity contains the urinary bladder, reproductive organs, and the rectum. Question 14. Inflammation of the serous membrane lining the abdominal cavity is called pleuritis. Pericarditis, peritonitis, or meningitis. The correct answer is option C. Peritonitis is inflammation of the peritoneum, often caused by infection or rupture of abdominal organs. Question 15. The mesentery of the small intestine is specifically called the mesentery proper. Mesocolon, mesoappendix, or greater omentum. The correct answer is option A. The mesentery proper, or mesentery of the small intestine, attaches the jejunum and ileum to the posterior abdominal wall. Thank you for watching. Don't forget to like, share, and subscribe.